A very warm welcome to you, and thank you so much for joining our Homeopathy 24/7 podcast. We are going to be speaking to an array of international guests who will share their knowledge and experiences of homeopathy with you. We will discuss all types of subjects such as remedies, symptoms, and stories of health. No matter where you are with your homeopathic journey, we aim to inspire you on your quest to natural health and living. The podcast is brought to you by Mary Greensmith, the founder of Homeopathy 24/7, which is a global platform connecting you with a homeopath wherever you are in the world, 24 hours a day. So let's get started with today's chat. Please welcome Mary Greensmith.
Hello, welcome. It's so lovely to see you. Thank you so much for joining us. And today I am really pleased to be able to welcome Lisa Robbins. Thank you for joining us, Lisa.
Thank you for having me.
It's so lovely that we get this opportunity to talk about homeopathy for half an hour. What is it that you would like to discuss about homeopathy today?
I'm particularly focused on heartburn and acid reflux, which, if they become continual, turn into something called gastroesophageal reflux disorder, GERD for short. But heartburn and acid reflux affect 1 in 5 people in Western countries. So it's a big problem. And if they go unchecked, they can lead to something more serious. So why not nip it in the bud with homeopathy? It's very useful, holistic, gentle approach that is long-lasting.
Lisa, I know that you've helped a lot of people with a lot of different gut problems, and I think you're so right in saying that reflux is something that so many people suffer from, whether it's eating the wrong thing or the body's not agreeing. There are so many different reasons for it. But can we just start with explaining what happens if you use conventional medicine? What does Western medicine do with acid reflux?
Well, I have to be honest and say that, of course, it works at first.
Yeah.
It lessens stomach acidity. And what is heartburn and acid reflux? It's when there's too much acid in the stomach, and then it needs to be released, and it goes up the esophagus. And I'll get to that if you ask me. But with respect to conventional medicines, usually what people take are antacids, and they do reduce the stomach acidity and therefore relieve the problem, what's bothering them most. But over time, they can cause gas, lots of flatulence and burping, constipation or diarrhea, which means that they're causing the very problems that they're supposed to be resolving. They also can swell up the hands, the feet, and the ankles. The absorption of nutrients is often compromised. I'm saying if you take them, not just once, but if you take them, the electrolyte balance is skewed, and that can have a negative impact on muscles and nerves. And then mineral salts like phosphate and calcium are flushed out whenever those antacids are aluminum based, which means that your bones get a bit weaker. So that's one problem with the antacids. But then people are often prescribed proton pump inhibitors, PPIs as they're called for short, and they also lower stomach acidity. However, over time, they can cause shortness of breath, problems with vision, a nervousness, a tiredness, and a depletion of vitamin B. And that's why I think homeopathy is a much better choice. The problem is it's not as immediate as these conventional solutions.
Okay, so I think the hitting the nail on the head there is the fact that with normal medication, with Western medication, it is solving the problem right now today, and it is knocking that out. But you have to keep taking it because it's not resolving the issue. It's not addressing why you've got acid reflux. So what might be some of the reasons why people would get heartburn or acid reflux?
Well, there's certain people that are more at risk than others. It's something that happens to people who are overweight. and people who are smokers. And the reason for that is because the constant smoking tends to weaken, in fact, both of them weaken the lower esophageal, the valve that doesn't close. The lower esophageal sphincter, which is supposed to allow the food, not allow it, stop it from coming back. So the food goes down the esophagus, which is the pipe that connects from the mouth down to the stomach. It goes down just fine. Then it gets there, the door opens, it goes down into the stomach, but the door doesn't close when you've got a heartburn and acid, and therefore it comes back up. There's too much acidity. And it's that ascension of the food that causes the horrendous chest pain and other issues. So basically, you're more at risk because the valve is being compromised, that lower esophageal sphincter, by being overweight or by smoking. But there are other people who are more at risk as well. For instance, if you're pregnant, there's a fetus inside and it's pressing, it's taking up a lot of space and pressure on the stomach. And your hormones are doing all sorts of new exciting things because baby's coming. And that can also weaken this valve, this sphincter. Strangely, something you wouldn't think would affect it, because of course you know that it's a good idea to have exercise, but if you eat and then you have a high energy workout, big mistake. Your everything in your body's focused on digesting that food. So a high energy workout isn't going to bode well. It's going to create the blood flow is in the gastrointestinal area. It's not helping you with your workout. Another thing that puts you at risk is if you eat a lot of stimulating foods, chocolate, alcohol, fizzy drink, caffeine, spices, fatty foods, fried foods, citrus fruits. All of these exacerbate the heartburn symptoms. If you're taking drugs for other reasons and nothing to do with heartburn, you put yourself more at risk. For instance, non-steroidal anti-inflammatories can cause trouble. Antibiotics, painkillers, birth control pills, HRT, steroids, and even certain antidepressants can cause an intensification of acid reflux. So there are quite a few reasons why you might have this problem.
Yeah, absolutely. You've covered a whole host of issues as well, haven't you? So and also there might be medical issues as well. I know that hiatus hernia causes a lot of reflux and things like that. So there might be something medical. So what we're saying is that the normal off-the-shelf medications or acid reductors effectively are helping you right now, this minute, but they're not addressing that cause of the issue. And that is where homeopathy is so different, isn't it?
Yeah, it is. Why is it so different? Well, first of all, it's the second most commonly used medicine in the world today, and it treats a multitude of illnesses. But basically what it does that the conventional medicines don't do is it treats the individual. How do you manifest symptoms and how do you cope with them? It's tailor-made for you. I'm not going to advocate the same remedy for each patient. It's going to depend completely on how they react and on how they cope. And that's probably one of the main things that makes homeopathy so very different. But it's also working on 3 levels: physical, emotional, and mental levels. It's holistic, and it's going to sort out, if you get the right remedy, it's going to sort out the entire dysfunction that has in some way caused or fueled the acid reflux.
Okay. So it's actually helping the body rebalance and be stronger so that the symptoms don't occur as often.
Yeah.
Okay. But of course, let's just bring in, there are a couple of things that are jumping to my mind. First of all, let's talk about maintaining causes, because if I keep on eating chocolate, it's however much Nux vomica that I need, it's if I keep doing the same things that are causing the imbalance, it's not helpful for my body, is it?
No, one of the biggest problems I have is patients saying, "Okay, great, I'll take your remedy," but they're afraid to not take the antacid. They're afraid to stop with,
Okay.
and I mean, it isn't that I would want them to stop right away anyway.
Yeah.
The way homeopathy works is it complements
Yeah.
what you're taking, but over time, you should be able to reduce the conventional medicine because the homeopathy is addressing the cause, is getting actually below the cause down to the root cause of what's created the heartburn in the first place. So not only is the conventional medicine maintaining cause, but the other thing which you brought up is that you've got this tendency to put things that you shouldn't put in your body
Yeah.
Why do we do that? Well, there's so many reasons. There's the comfort food idea. There's the habit. There's, mainly those two, it seems to me. But, it's very difficult to wean yourself from what has been useful in the past. And so you have to change the way you think. And quite honestly, I think homeopathy helps do that as well. You
It
don't
does.
want it as much. You don't need it.
Exactly. Exactly. Because as you said, it's helping you balance emotionally as well as physically. And therefore, if you're less anxious, if you're less worried about certain things, your metabolism is better and you're not needing those comfort foods. So that's a really good point. But I have seen huge changes with people who are suddenly able to tolerate a lot more things that they weren't able to before, especially if there are certain foods that really upset their stomach. Um, Now, one question which I don't know the answer to, Lisa, why is it called water brash in the in the repertories? Where did that come from?
Oh, that's a very old term. And in fact, actually, it's quite useful when you're doing your research to find out what a client might need. But it isn't a term that you hear very often. It's basically the fact that there's this fluid, acid watery fluid that's
Yeah.
coming up from below into your esophagus, and then if you're unlucky, right up into your mouth so you can taste it. And that's why it's called that. To be honest, I can't define water brush any more specifically, but as far as I know from my own research, that's why it's called that. Basically, the stomach is backwashing its contents into your throat,
Yes.
and that causes horrendous chest pain, abdominal bloating, because it also stays down there, difficulty swallowing, and if it goes all the way up, that horrible sour taste in the mouth. So it can also cause bowel symptoms like constipation and diarrhea. Lots of fun.
So it is a whole digestion issue, isn't it? And usually you've mentioned already the valve at the top of the stomach where it joins the esophagus might need strengthening. But actually, we do need to be looking at the whole digestive system and asking the questions, well, what else is going on here?
And usually there, as I talked about some of the risks, but you mentioned hiatus hernia. That's one thing that could be going on. That's when the upper part of the stomach pokes through that place between the chest and the abdomen, and it's really unpleasant. It's and there isn't really a solution for that except operating, which doesn't always do much. But there are other problems that if a lot of people think, oh well, I can deal with this. I'll just pop my
Mm,
tum day and I'll be fine. And yes, indeed, that will work for a time. But over time, if it goes unchecked, in addition to problems with hiatus hernia, there's the problem of the esophagus becoming really inflamed, and then we have a condition called Barrett's esophagus, which is a quite serious ailment that needs a good look-see from a doctor, and perhaps even worse or as bad as that, a stomach ulcer.
yeah.
Which over time can narrow the lining of the esophagus. So you get this scar tissue that grows, and then it's hard to swallow, and then chest pain comes from that. There's this feeling that there's something stuck in the throat, and this stricture of the esophagus can cause vomiting, choking, breathing difficulty. So, on the one side, this is a minor thing, heartburn, acid reflux, I can deal with this. On the other side, if it becomes something more of a daily occurrence, it's definitely something to address. Your body's trying to tell you something. Pay attention.
Yeah, absolutely. The symptom is there to stop you doing something, isn't it?
Yeah.
Stay, no, you mustn't do that to me. I don't want that. But we're so used to just ignoring and not listening to our bodies. Now, I know that some people have miasmatic tendencies. They are born with a susceptibility to particular problems, precancerous cells in the esophagus and that sort of thing. And it can run through families. And when you have a look and ask about family connections, you find that might be an issue. What can we do? Where are we looking with homeopathy with that? Because there aren't many other types of remedies, types of medicine, which can actually strengthen that inherited susceptibility.
I think that would be more a matter of what specific symptoms do you the client have? In other words, how do you manifest? This will be something perhaps you inherited, but we won't be looking what we'll be doing is looking at what it is that's specific to you. So something about your familial tendency will have translated into the way you manifest, and also the way you cope. It'll be something from the generation, like your mother or your father, or something from even the generation before that. So the beauty of homeopathy is that there's a reason why your ancestors developed that tendency, that propensity for, and it is probably something that isn't digestive to start with. It's something deeper. And that has then transferred over the generations to you. And so when we give a remedy, it's working on an energetic level to address the vital force, which means address that very thing that the ancestor first developed the symptom as a result of. I don't know if that makes sense, but that's the best way I can explain it.
Okay. So what we're really saying is we've got multiple levels here of health, haven't we? That we've got the everyday, we've got symptoms that you're experiencing now. We've got the reason for that, if there's a physical reason for the body. And also we've got a historical reason that might all be collating and coming together to give you the symptoms the way you experience your symptoms. So, and what you've said along the way is that if 10 people come to you with heartburn or acid reflux, they're going to have different remedies. And that is the reason why, because their history is different, their physical symptoms are different, and because their emotional symptoms, the way they're experiencing those symptoms and how it affects them is very different. So we've got a huge array of remedies to be looking at. And there might be a few that we're used to thinking of on the first aid basis, but actually to go deeper, we're really opening the book, aren't we? We're opening it to any possible remedy.
I usually do look, there are top remedies. There are top remedies for heartburn, and I do look at them and I think, does this match?
Yeah.
And it is a marvelous starting place because there's so many remedies out there. How else are we to begin? I mean, I use computer software and I zoom out and think about what is this patient like? What is it that makes that particular patient the way she is or the way he is, and that those two things really help me a lot. In other words, what are the top remedies for heartburn, and how is this patient what is it about this patient that might match one of those remedies? In other words, the way they behave, the way they experience the symptoms, what makes it better or worse. I have an acid reflux patient at the moment who told me all her symptoms, and I said, okay, so it's winter now. I must have spoken to her in January at first. Tell me what's your ritual when you go to sleep? And the first thing she said is, well, I turn the fan on. You turn the fan on. Interesting. I know immediately I need to look at Carbo Veg because that is better for fanning. And she has the fan on all year round. And sure enough, I gave her the Carbo Veg and she's feeling better. I'm not sure that it'll be the be all and end all, but it's a marvelous start, and her symptoms improve, not just digestive, but even endocrinal symptoms, the hormonal issues.
Yes. Okay.
So what I'm saying is that particular remedies have particular peculiarities that help me to okay, that person has this way of experiencing.
Yes, yes, indeed. And of course, everybody you talk to, every case that you're talking, you're finding information that it's all those pieces of the puzzle that are coming together in order to point you to a remedy. It's just fascinating, isn't it? So let's just talk for a moment about why somebody should consider homeopathy if they are suffering from heartburn or reflux, because obviously we've talked about, yes, you can buy things off the shelf and you can, take things when you've got an issue. But what we really want to help people with is the fact that if you have the right remedy, you don't need to keep taking remedies or medicine for the rest of your life.
Yeah, that in fact you've just answered your own question. Thank you. What you've said is that it lasts. It isn't like the temporary fix that the off-the-shelf conventional medicine will give you, and it will work because the homeopathy is going deeper than that. It's going to the underlying root cause of the issue, and by doing so, it's going to last longer and possibly. Oh, that's the first reason, because it'll last longer. And there's another reason too that I hadn't really thought about, and that is that homeopathy doesn't work the way conventional medicine works. It reminds the body how to heal itself. So it's saying to the body, no, you're not, this dis-ease is because you're out of balance. There's no homeostasis here. What you need to do is it sends a message, instructions to the body, which then takes those instructions, and initially it doesn't necessarily work on the physical level. Initially, it works in a mental outlook, a change in the way one thinks, or in an emotional ability to let go, to sit back. But over hopefully a day or two, it will begin to affect on a physical level as well, because the body is remembering what it knows how to do. Take one of the top remedies for heartburn, which is Robinia. This is for hyper acidity, and there are burning pains all the time. There's colic, there's burping. Symptoms are worse at night, worse if the patient lies down. There's a frontal headache, which is unpleasant, and sometimes a bit of vomiting. And the patient's usually constipated, even though they'd really like to go. This remedy addresses those problems in a way that conventional medicines might help, but wouldn't. It's like they're not focused enough. They're not refined enough, and that's the beauty of using a homeopathic remedy instead.
That's interesting. I don't use Robinia very often. I haven't prescribed Robinia very often. So really interesting that that's your first thought, and you're using it a lot with the clients that you're seeing. But I know that you do see a lot of clients. You have a good gut community. You have a Facebook group where you're talking about gut things all of the time. Tell me a little bit about how you are bringing people together to discuss gut issues.
Well, we have a Facebook page, and it's called Homeopathy for a Healthy Gut. It's part of Homeopathy 24/7, which is the marvelous organization, as you know, that allows people to contact homeopath at any time over a 24-hour period for acute issues as well as chronic issues. So it's a marvelous opportunity to solve what's wrong. And our Facebook page is devoted to digestive disorders specifically. We've got about 2,500 members at the moment, and we're going strong. And I suppose the way we bring people together is through the posts that we make, which address different aspects of. Right now, we're focused on how gut is related to asthma and hay fever conditions, because this is a big hay fever time. But there are a myriad digestive issues that come up. Some of them less serious, well, I guess I think they're all serious. I can't really say some of them are less serious because of what they lead to if you don't do, and others turning into chronic diseases. And I think what's marvelous about the community is we will post something and then somebody will ask a question that is related to their specific problem. I get such and such, or my child, or whatever. And then you can, we've got a team of 5 of us that address those questions with recommendations for remedies. And of course, we also say to them, if you're not working with a homeopath, get in touch with us. We offer discovery calls, and people come in and meet us for 15, 20 minutes on an individual basis to discuss what's going wrong. And we can say, this is how homeopathy will help. And then we will set up with them a full consultation during which we hear what are the origins of their digestive disorder, and what have they done in the past, what's worked, what hasn't, how do they experience the disorder in terms of what makes them feel better, what makes them feel worse, and what are they hoping that that the remedy can do. And I've just been very impressed at how forthcoming people are about what's wrong, and how they aren't afraid to ask, to put out there, I've got this trouble with my colon, or with my constipation, or whatever. It's marvelous. It's a terrific give and take. So we post, and then they ask questions. I run a little quiz so that if people want to hone their skills as home prescribers, they can do that. But what's really nice is we get these sudden influxes of new members. It's become a what does one call that? Past the I know how to say it in Italian. Where it's by word of mouth.
Yes. Okay. Yeah, yeah. And I know that it's doing well, and people are sending people to you, because the amazing thing about having a homeopathic remedy, whether it's for acid reflux or whatever it's for, is that it's not only going to help solve that problem, but it's going to help other problems as well. And nobody really expects that, do they?
Because nobody realizes that there's a thread. There's a thread that runs through all the symptoms, even the ones that are less obvious, because you're what's bothering you now is the heartburn. But for instance, hiatus hernia could be something in the background, or the beginnings of a stomach ulcer could be something in the background, or constipation or diarrhea. They're all linked by the thread. And so when you find the right remedy, and to be honest, more than Robinia, I prescribe Carbo Veg and Arsenicum. And I also prescribe a tissue salt, Nat Phos, which helps it's just a marvelous stomach acidity solution. But anyway, when you prescribe that, the system, the entire body, the immune system, the respiration, the digestion, the elimination, all those systems they pull their socks up.
Yes, yes, yes. They start reacting and
Yeah,
doing what they're meant to be doing.
right,
They've
right.
they've kind of fallen slack. And just as you were talking then, I just had the vision of actually we're piecing together pieces of the puzzle and always asking questions. It's a little bit, like being an investigator, isn't it? And then you're creating a quiz for people. So it's because homeopathy is quite complex in bringing together so many elements, isn't it?
It is, and I studied it many years ago, and then decided, no, I can't do this, and then came back to it 20 years later.
Oh, really?
I mean,
Okay.
I got all the way up to the bell nosodes, and then thought,
Yeah.
oh, I can't. I
Yeah.
mean, it's too complicated, and here I am.
Yeah. Oh, fantastic. Well, we're so pleased to have you, Lisa. We're so pleased that you're in the homeopathy world and giving as much as you do for our community. Thank you so much. It's been lovely talking to you. Thank you for joining me.
Oh, thank you for having me. I look forward to seeing this when it comes out on the air, and also I hope people will join our webinar, which will be oh, they will have joined it by now. They'll remember it when they watch us.
Of course, but the thing is, you have several webinars coming out in
Yeah.
this topic. So we will be putting links to those because obviously they might be able to catch up later anyway. But by joining your community, I know that you've got a very active group of homeopaths who are producing information for people all of the time. So we'll put all of the links below, and hopefully people will be able to connect with you and you can help some more people along their journey.
I hope I can. I've certainly been very pleased with what I've been able to do, or really not what I've been able, what homeopathy's done. I'm just the guide. And thank you for this opportunity.
Thank you so much, Lisa, for coming on and talking to us about homeopathy for acid reflux. It's a really intriguing conversation. Now, next week, I'm going to be talking to Gitanjali Joel, and we'll be talking about homeopathy helping people with anxiety. Now, of course, anxiety is another topic that is experienced in so many different ways, and we're going to be breaking it down to how you're reacting both physically and emotionally and finding the remedy that might suit you best. Now, this is a huge topic, and we are just going to be touching the surface with what to look for, what to note, how to collect your symptoms, and then where to go and collect those remedy information that you're going to be needing. We'll be talking about some of the remedies and why they're useful, and we'll be helping you put that information together so that you can help yourself and your family. I look forward to seeing you then. Take care. I do hope you've enjoyed these episodes, and I do hope you can subscribe to our channels. Now, there are various ways for you to listen to our podcast or watch it on video on YouTube. So whether it's iTunes, Spotify, or YouTube, please do subscribe and please do leave us a review. If you leave us a review on these platforms, then more people will see our podcast. We just want more people to share the joy of homeopathy. It's a choice that everybody should know about. Please do everything you can to help us help more people.
We hope you enjoyed today's episode and look forward to listening to our next one. Please don't forget to follow our podcast on your chosen channel, and please do leave us a review so we can continue to share homeopathy with as many people as possible. If you do have any questions, please do reach out to us on any of our social platforms mentioned in the show notes. We at Homeopathy 24/7 hope to empower you on your natural health journey.